We have a problem, and the problem is we have here the most common congenital cause of infection, period. It is the most common cause of infections causing pediatric hearing loss. It is, in fact, second only to genetics in causing congenital hearing loss, period. It's an entity that is more common than Down syndrome, fetal alcohol syndrome, spina bifida, and HIV combined in children, where 1 in 200 approximately are affected with this. 1 in 3 women who contract cytomegalovirus will transmit to their fetus, and approximately 20% of those children will have permanent health challenges. And yet, it's safe to say 10 to 20% of women of childbearing age are familiar with this entity. And certainly less than half of our states are in a position to be screening for this public health problem. So we'll look at some of the whats and the whys and the hows. So what is CMV? CMV is the member of the herpes virus family. It's a large, complex DNA virus that has several spheres. Centrally, the genetic material is present. It's then surrounded by this outer capsid with then another layer of buffer proteins, finally enveloped by a glycoprotein layer. CMV is of the same family as varicella and Epstein-Barr or herpes simplex 1 and 2. And it's common. It's very common. As a matter of fact, approximately 1/3 of children in daycare settings will have this by the time they're 7 years old. Somewhere between 50 to 80% of adults will contract this virus by the time they are in their 40s. This is an entity that's very well known in the transplant population as it has significant consequences for morbidity. CMV is costly. It's hard to know exactly how much, but projections in the mid-90s estimated $4 billion, which when calculated by today's term would be about $8 billion in healthcare expenditures. But CMV is preventable. There are common behaviors that increase the risk of transmission, and when those are eliminated, the risk of transmission significantly drops. And finally, there are treatments for this entity. There are opportunities for medications which can delay and minimize disease progression, that can reduce the transmission potential from mother to child. And of course, there are therapies which can take children who are affected with this and look to optimize their growth and development. When we think of CMV, though, we're going to focus on the vulnerable populations because it is very common. And in this talk, with congenital CMV, focus on the unborn child and what that means. Historically, congenital CMV has been categorized by symptomatic and asymptomatic groups. Symptomatic being those where you look or present with illness. And you'll see on the screen the long list of conditions that can be associated with this, affecting the gastrointestinal, hematologic, neurologic, ophthalmologic systems in nature. Only 10% of children who are born with congenital CMV, though, demonstrate this, and the large majority are technically asymptomatic. However, that definition is being challenged because hearing loss, for example, is something that you can't see, but it's a very unfortunate common complication of congenital CMV.